my practice was hypoglycemia because everybody thought they had hypoglycemia, but and many did because again we were all consuming a lot of sugars. And I had it myself, and I have a tendency toward it because I was a sugaraholic when I was a kid. And for years and years, I suffered. I was an A+ student sometimes and an F student other times. And I never could figure out why I was this up and down type of personality. And finally, I remember being sick, somewhat sick, for like 7 years, trying to think of why I was always fatigued and fell asleep in the afternoon and couldn't function. I would, I'd have a little lunch, and then soon I'd be falling asleep in class, and so I'd sleep through the 2 o'clock to 3 o'clock class, and I'd be very frustrated because I was trying to learn as hard as I could, but I couldn't stay awake. And I finally figured out that it was bananas. For me, I had one banana every morning in my Wheaties and my milk, and I said, gee, that was a healthy breakfast, because everybody told me bananas are great and healthy. Turns out that one banana has 2 tablespoons of sugar. And for me, that was too much. And it caused me to have a reactive hypoglycemia episode, and so that put me into what's called neuroglycopenia, which made my blood sugar go down, my brain didn't function, and I fell asleep then in the afternoon. So that's that point. And so after I got off of the sugars, then my mood stabilized, and I stopped having those episodes, and everything got better. And I didn't become straight A+, but at least I stopped having the Fs as many. So I just bring that up. And then another thing I wanted to mention was fructose. And everybody talks about fruits and sugars, and you want to eat lots of fruits, and I tell you that's not true. Fructose doesn't cause cancer as much as atherosclerosis. And many years ago, 25 years ago, they first showed it in monkeys that IV fructose causes atherosclerosis in monkeys. And now, in the last 10 years, we've shown that oral fructose causes atherosclerosis as well. So you don't want to eat much in terms of fruit, and you want to have it with your meals or as a dessert, but not just munching it. Some people just get into eating fruit because they like fruit, it tastes good, and they think that's healthy because everybody talks about it. And everywhere you go, they always say, eat your fruits and vegetables, eat your fruits and vegetables. No, you should eat your vegetables and then a little bit of fruit. So I want you to know that too. And if you don't trust me, go to Google and look it up. Whatever I say, don't trust anybody, go look it up. Study on your own. You guys are all smart enough to do it. You all learn how to run a computer. Use that computer. Another one I want you to mention is curehunter.com. If you're really interested in learning about medicine and learning about everything that's going on in your body, curehunter.com, you go there and type in any disease, and you'll be amazed the amount of data that you get. It's an amazing site. And you can buy a report on any disease, pretty much any disease, for $24, and you get 100 pages of detailed information about your particular condition, listing all the drugs or whatever that are number 1, number 2, number 3 in the literature. It's a comprehensive review of the medical literature about that particular condition. So curehunter.com is something I want to mention too. A great new asset for all of us. So tonight I'm going to talk about stem cells. Now, mostly I'm talking about bone marrow stem cells, but I also wrote that book that I was talking about umbilical cord stem cells. So I tend to be an expert on umbilical cord stem cells, and so those are also very, very good. And I'll just say briefly, people are asking, what about which is which? I say in general, they're equivalent if you're talking about people under the age of 40. So a bone marrow transplant oftentimes will do just as good as umbilical cord stem cells if you're under the age of 40. But when you get past that, then the umbilical cord starts to take over because you're using umbilical cord, which are very vital, very full of life and full of growth factors. And as you get older, as you well know, your growth hormone starts to fade at 40 and it continues to drop. In fact, if you look at growth factors in your tissues in your blood, and you measure a child's, like a 1-year-old's growth factors, you get levels of something like 10,000 micrograms per ml of the different growth factors, and there's hundreds of growth factors, and you can measure most of them, or a lot of them. And then you compare that with a 90-year-old. The 90-year-old has 5, 10, 20, maybe 100 of micrograms per ml as compared to 10,000. You see, so there's virtually none in the person as you get really old. And that's why you have osteoporosis and you have sarcopenia, the loss of muscle mass, and the atrophy of your tissues because of the fact that you don't have growth factors. And the growth factors and the stem cells work together. And it's important to understand that it's a concept that 2 together are what causes you to stay healthy and young. It's not just stem cells. It's not just growth factors. It's the combination. Okay? So I think stem cells, I think it's like right there, up there with the discovery of light, fire, the internet, major, this is one of the, I think, as far as I'm concerned, it's the #1 major discovery in my lifetime in medicine. And if I get my clicker to work here, I'm over in Mission Viejo, which is about an hour south of LA, about an hour north of San Diego. I have a center there that we take care of almost all chronic degenerative diseases. Stem cells, most of you know, basically you start off with an egg and a sperm and you put that together, you get a zygote, and that zygote is really the first stem cell we have, and that's a totopotent. It becomes a whole human being. That's totopotent. Then it goes from there, it turns into smaller, different kinds of cells, which are blastocyst cells, and cell mass, and you probably all read about that, and how those blastocyst cells can be then turned into embryonic stem cells and can be used for treatment of different things. The only trouble with embryonic stem cells is that they are so undifferentiated that when you put them into the body, they can be influenced, and they are influenced by your own body's tissues, and they are influenced by the environment that they are in. And so when you put them into the body, and if they get into an area where there's no attachment, they don't know which way is up or down or right or left. And when they're in that area where there's no up or right or down or left, they start to grow crazy because they don't have orientation. And this lack of orientation allows the cells to grow into all kinds of tissues, and they grow into a teratoma. And that's because of this lack of orientation. If they had orientation, they would then become the tissue that they're localized in, and they would then know what is the tissue that they're dealing with, and they would grow into that kind of tissue. But since they don't know in that situation, they grow into teratomas, and all these growth factors combined working against each other causes then teratocarcinoma, and that's one of the big problems with the use of embryonic stem cells and what the scientists are trying to combat and try to make these things into drugs. Anyway, so I keep on going here. So stem cells from your bone marrow circulate throughout your bloodstream on a daily basis. They go throughout your body and they go in your bloodstream. They're there now. And if you have injury of your blood vessels, and you know there's 246 different risk factors for atherosclerosis that causes damage to your inner lining of your blood vessels. The inner lining of the blood vessels it's called the endothelium, and the endothelial cells are very fragile and can be injured by almost anything that's irritating. And so cholesterol, especially oxidized cholesterol, irritates the endothelium, and triglycerides irritate it, smoking cigarettes, pollution, all kinds of things can cause irritation to the blood vessels. And these damages need to be repaired, and those damages are repaired by stem cells. So as you get older and your stem cells don't work and function as well, then your blood vessels no longer get repaired as well. And that then leads to atherosclerosis and degeneration of the body. So bone marrow stem cell therapy is legal in the United States, according to my attorney. Whether or not that's true is dependent upon who in the FDA says it is or isn't, and whether or not I'm doing anything bad in terms of patient results. If I have any kind of bad results, I'm sure they'll decide that it's illegal. So here we have a picture of the bone marrow on your left, and you can see the different types of cells that are in general coming out of the bone marrow. The stem cells produce all these different cells on the right. Here's just an example of the bone marrow, and here we have the hematopoietic stem cell, these cells right here. And so in the bone marrow you have two types of stem cells. You have the hematopoietic stem cell, which goes into those cells that we just showed you, the red cells and white cells. But then you have these cells, which are the stromal cells or the mesenchymal cells, and they produce growth factors, and they support the health and nutrition of the hematopoietic stem cells. These hematopoietic stem cells are the ones that are released into your bloodstream every day, all day long, and they're the ones that are in general repairing your body. These, the mesenchymal stem cells, stay in your bone marrow in general and don't come out. Now, when you stop and think about it, all of us, or most of us, get arthritis as we get older. And one of the reasons why we get arthritis is because these cells, which go into repairing bones and joints, do not circulate. They stay in the bone marrow. you see. So if these were able to be forced out and circulating in the system, we would be able to fix arthritis ourselves, because we would have these cells circulating, and they would be then able to go to the joints and connective tissue and cartilage and skin, and we would no longer have our faces getting older and all that. Our skin would improve considerably in terms of our aging process, because these cells have a rejuvenative effect on the entire body. And so we talked about the different poetic precursors. These, they form the endothelium, the inner lining of the blood vessel, the capillaries, differentiated tissues, and they're multipotent. And again, this is how you spell that mesenchymal thing I was talking about, or strong cells, provide physical support and growth factors. So you need about 4 to 8 of these mesenchymal stem cells to every one of the hematopoietic stem cells for optimum growth of tissues. And so when we're treating patients, if we could, we'd like to give this combination, because the combination gives better clinical results. The only trouble is, like I say, the mesenchymals are stuck in the bone marrow, whereas the hematopoietic stem cells can be induced to be released. So, for example, if you have cancer and you go to the doctor and they're going to treat you with chemotherapy, and then they're going to give you a bone marrow transplant or a stem cell transplant, what they do is they give you a stem cell mobilizer, and that releases hematopoietic stem cells, but not the mesenchymals. And so you don't have a complete set of stem cells to repair tissues. But you can get the combination by a bone marrow transplant, because when you do a bone marrow transplant, you take the bone marrow out of the person, you get both of those types of cells, and you put both of those back into the bloodstream. The hematopoietic stem cell is also called CD34 stem cell, and that just stands for glycoprotein found on the immature hematopoietic cell, endothelial cell outer surface. So this is again another just picture of the bone marrow. Here's oxygen. One of the other points to remember is that stem cells like areas of low oxygen, and they stay here they're along the inner lining of the periosteum and the inner side here. This is where they're most concentrated. The stem cells are mostly right along in here. This is the central blood vessel in here and the capillaries here. And this is just a diagram showing the mesenchyms and the hematopoietic stem cells. And so as again, I already said, the functionality of your bone marrow is important for aging. And so if you keep your bone marrow healthy and your stem cells healthy, basically you're going to stay younger and healthier for a long, long time. As I said, arteries, of course, develop atherosclerosis, and this is due to a combination of lack of repair and the damage that occurs. Once you have a guy by the name of, what's his name? Felix Meersen. Felix Meersen wrote a book called The Failing Heart in 1993, in which he describes the fact that as we get older, at the age of 60, you have 10 times more calcium in your arteries than you do when you were a 10-year-old. And this calcium accumulation causes damage of your tissues in terms of lack of oxidative phosphorylation. Oxidative phosphorylation is the process of the mitochondria taking glucose and combining it with oxygen and turning it into ATP. And then as we get older and some of these injuries occur, the injury causes or allows calcium to go inside of the blood vessel wall, inside the smooth muscle and whatnot, and the calcium wraps itself around the mitochondria of these tissues and these cells, and this calcium then, as it wraps around the mitochondria, activates the process of oxidative phosphorylation, which means that the cell no longer can make ATP, and ATP is what is needed to repair it. And so ATP is very essential. Also glutathione is part of this process as well. In any case, the point is that stem cells help heal those injuries. and prevents that calcium from accumulating in the first place. So you have to, if you have stem cells, they're going to be able to repair it quick, as compared to allowing that injury to continue to allow that calcium to get in, and that causes then the progressive deterioration, because it's at 60 years of age is basically when your body starts to deteriorate because of this process of gradual calcium accumulation. Now just again, here's a diagram showing the bone marrow and the different kinds of repair processes that you can start. These bone marrow cells can, these are the stromal cells and mesenterals here, which can repair skin, epithelial cells. They also can repair neurons and cardiac muscles, skeletal muscles, bone, fat cells. The hematopoietics can do also a lot of these same kinds of things. These are some of the conditions that you can use for treatment of stem cells, and that's both umbilical cord stem cells and bone marrow stem cells. And I think in terms of bone marrow transplants, osteoarthritis is number one in terms of efficacy. About 80% of patients who have severe arthritis, osteoarthritis, degenerative joint disease, will have significant improvement of their arthritis with one bone marrow transplant. I've had people who have been on morphine I remember one patient who was on morphine because of his arthritis of his back, and he's complaining, and I hate people complaining, and I said, "You, get over here, I'm going to give you a bone marrow transplant." And he said, "Oh, okay." And I put him in my exam room, and I gave him, took bone marrow out of his hip and put it back into his bloodstream. It's a simple process. And by that night, he was out of pain. He didn't need morphine again. Acute and chronic heart diseases, especially congestive heart failure and acute myocardial infarctions, are helped immensely. I've had people with severe congestive heart failure within 1 week have the heart failure disappear with stem cells. Acute and chronic brain diseases, you're talking about Alzheimer's, stroke, Parkinson's, MS. Somebody mentioned he has this child, boy with MS. Umbilical cord stem cells given, or purified bone marrow stem cells given into the cerebrospinal fluid is the current method of choice for treatment of brain injuries. Traumatic brain injuries are these chronic different diseases. Musculoskeletal injuries, I think in general, if you're under 50 or 40, bone marrow is probably the best thing to use in combination with platelet-rich plasma. And again, cartilage and meniscus repair. Spinal disc disease, we have a spinal disc device that pulls the spine apart, not apart, but it gives traction and allows the disc to pop back into place, and we combine that with our stem cells. Yes, sir?
Is this all you're talking about using their own bone marrow?
Yeah, in this situation, yeah.
And all those?
You can use your own in all of these, but like I said, there's differences because when you get to the older folks, the growth factors are decreased considerably. So what I do there is either if I do bone marrow, I want to give growth factors, and generally if you're doing an older person, in these cases you have to the bone marrow, you have to do it repetitively, and I'm going to go over that too, because it's like exercising your body. Stem cell treatment is kind of a thing that stimulates your body to become stronger and healthier. And so you keep doing it, and you get stronger and healthier, and better and better. I have on bone marrow, for example, I have an article in one case report in the Townsend newsletter 2 months ago, talking about one of my patients who is in remission from Huntington's with bone marrow transplants. But he's a younger person. When you get to be an older person, it becomes more problematic to use bone marrow oftentimes. And so and then of course the bone marrow is cheaper as compared to umbilical. And so you have all these things to weigh back and forth whenever you're dealing with each one of these conditions: the age of the person, the other conditions, the overall state of health of the person. All of these things come into play when you try to make a decision as to what kind of cells you use.
The older people are the ones that have those diseases. That's the trouble.
That's exactly right. So they become more and more difficult. The older you get, the more out of shape you get, the worse it is, the more difficult it is to reverse it. And that's just the way it is. And so, for example, yesterday I think it was, I did a patient who is wheelchair bound, multiple sclerosis for many years, unable to use either leg. His right arm is semi-paralyzed. Total osteoporosis. I mean, it was like a jellyfish. I put the needle into his bone. I didn't need to do anything. We just put the needle in, right through the bone, right in through the hip. Instead of having to drill it like I normally do, a normal person, I have to have a drill. Not him. I said, oh, okay. And then went ahead and started sucking. But the bone marrow was very poor. Half was fat, half was bone marrow instead of normal bone marrow. So, he's dying right there. And he's slowly dying. And half of his bone marrow is gone, and his bones are gone. And, he's just a shell of what he was. To bring him back is going to take a lot of time and repetitive therapy. But if we do it every 2 or 3 weeks, give him another bone marrow, what happens is that the bone marrow transplant that we give has some growth factors, and that stimulates the bone marrow that's in him, and that makes those bone marrow stem cells grow better. And the next time we do it, they're better, and they give more growth factors, and we just keep building, and the stem cells keep getting better and better and better. Okay? And his body keeps getting better and better and better. This is just a list of things where you get significant effects, and that's the anti-aging, especially the mesenchymal stem cells, as I said. When you look at the literature in terms of anti-aging, a couple, 3 years ago I was reviewing it, and we looked, and it was pretty negative about using stem cells for anti-aging in terms of clinical research and basic science research. It really didn't show much, and it turned out that what they were using were the hematopoietic stem cells, and that's been my observation too. When you use hematopoietic stem cells, the CD34s, you don't see that much in terms of anti-aging, but you do see it when you use the mesenchymal stem cells. And the reason for that is because connective tissue in general doesn't get younger. We can't change it. In general, it's pretty refractory to any kind of treatment. The only treatment I've ever seen that changes your connective tissue are these types of cells. The mesenchymal stem cells are able to change the connective tissue, and your skin gets better, you look better, you're younger, the skin smooths out, and I have people actually having their hair, some of their hair turned from white back to the original colors. So not everybody, but it depends upon the person and how much they do and all that. Diabetes, multiple treatments for type 2. Recently in JAMA, again, recently in this last issue of JAMA, they had one with diabetes type 1. They showed that they were able to cure diabetes type 1 with bone marrow transplants, but they had to use chemotherapy as well to suppress the immunological rejection phenomena. And when we did that, they were able to get some cures in the early stages as soon as the person developed diabetes. Colitis, ulcerative colitis, and Crohn's disease has helped. Huntington's disease in the early stages. Macular degeneration, if you go to the web, and my website is there on my card, it's stemcell.md. I've got some on YouTube. If you go to YouTube and put in my name, you'll get a bunch of videos of testimonials of patients that have macular degeneration and have great results. One of my patients I did as an illustration of how you can treat something. This guy had macular degeneration. He had optic atrophy from glaucoma. He had had visual field defects from strokes, and he had no sight whatsoever. His vision was totally black. He couldn't see he shined a bright light into his eyes, and the eye stayed dilated. He couldn't see a thing. And after much study and trying to figure out what to do, I had an ophthalmologist take a laser and burn the back of his eye slightly with a laser, burning that area, all the areas that were damaged, and then we put him 3 days later, took him into a cath lab and in Tijuana, and where this is legal, and I put a catheter up into his carotid and into his cerebral circulation. And then we put in mannitol, which is a type of sugar that opens up the blood-brain barrier. And then we put the stem cells, the umbilical cord stem cells, in directly into the retinal artery, ophthalmic artery. And within 1 month, he was able to read and eat again in his own food, and could tell what he was eating. And
Wow.
within 2 months, he was able to read pretty much normally again. And so this is a person who went from total blindness back to seeing pretty well.
Was the purpose of burning the active element to stimulate refractive?
Yeah, you have, generally what happens here is that, and it's an important concept, that if you have an acute injury in the first 10 days after an acute injury, like stroke, it's a good time to give stem cells. So when you have a stroke or know somebody's got a stroke, you want to give them to me or me to them within 10 days to give those stem cells if you want to save tissue. After that, it's harder to get the stem cells into the tissue. In that first 10 days, that tissue's been damaged, it's open, and it's ready to receive the stem cells. After that, it's sealed up, and you have less and less effect. The optimum time, if you can, is 72 hours after the injury. So 3 days after the injury is the time. So when I have an acute stroke patient, if I get him the first day, I'll treat him first with hyperbaric every 4 hours for the first day, and then the second day every 6 to 8 hours. And then on the third day at 72 hours, then I will often have switched to stem cells.
What was the age of that man with the macular degeneration?
He was, the one that was black blind was 73 at the time, or 76. Chronic kidney disease can also be helped with stem cells. Again, oftentimes you need, with bone marrow, oftentimes you need repetitive types. Now, the bone marrow, I don't have on this slide, and I don't have it in my presentation, but there's some tricks to treatment with bone marrow. One of the things is that as you get older, well, let me stop and say that it seems to me that there's a correlation between the health of your bones in terms of like osteoporosis, osteopenia, and good bones, and the health of your stem cells. So if you have severe osteoporosis, you're generally going to have poor stem cells, okay? And the number of stem cells are not going to be there, and they're not going to be very viable, they're not very active. However, you can change that by exercise, so by weight bearing and that kind of thing, that's going to be helpful. Anytime you can put more weight on your legs and keep pushing on the long bones, that is beneficial. And I'll just have you a little example of why that is. I don't have any example here, but if you took a femur, which is a pretty long bone, this bone down here, and had it laying here, it's dead, it's been there for the last, laying outside of the body for years. You can take it up here and you put a wire on one end and a wire on the other end and put the two wires together onto a little light bulb, and nothing happens, the light bulb is not lighting up. But if you put pressure on that femur, hard pressure, the light bulb will light up. Okay, that says that there's electricity being generated in that bone, you see. That's called a piezoelectric effect. And that piezoelectric effect drives the signals in your stem cells to generate the stem cells to grow, and it helps the bone and the osteoblast to grow, and so that makes your bone stronger. So that's why you need to have pressure on your legs and on your long bones to get those bones to be healthy, and the stem cells to be healthy.
So if you're bicycling, does that count, or do you need
It's not nearly as good as doing weightlifting or walking or bouncing, something that puts pressure. Really, you don't need to have so much jarring. It's just weights, like you stand on one leg and lift, that kind of thing. So you're putting weights on the long bones. So weightlifting is probably more effective for enhancing the strength of your bones. I'm not a physical therapist, so you should ask the physical therapist how to do it. New therapies, I'm associated now with a couple hospitals in Tijuana. One is a modern hospital that's approved for stem cells, bone marrow stem cells. That hospital does open heart surgeries. It's Excel Hospital, about 10 minutes from the border. And there we can separate your bone marrow stem cells and then inject them directly into the coronary arteries or into your kidneys or into your brain or whatever we want to. And so that's about, you're in and out of the hospital in 3 days. So that's basically in competition with the Thailand cardiac program and the Excel Hospital in Germany program. So that's...
What is XL in this context?
Yeah, it's Excel in Tijuana and EXCEL.
Is that the name of a company?
That's the name of a hospital, Central Medical Excel. If you need to, if you want to go there, send somebody, send them to me. You have my card. Go through me because that way I control the situation. And if you ever work with Mexicans, you know why that's important. It's important to have an American there watching over the Americans. Another thing that's important, we were talking, Mike and I were talking about somebody else who's been selling human fetal stem cells for a number of years, and how when you buy the stem cells from this person, you would get the stem cells in a foreign island, and with no preliminary evaluation and whatnot, you just go down and get the cells and turn around and go back home. Is that not correct? And I said that's inappropriate, it's not correct, it's not supposed to be that way, that's not practicing medicine, that's not the way things are. Stem cells are not a miracle of all miracles, and they don't fix everything. They are, like I was saying to start with, they are the Holy Grail, but with the Holy Grail you have to know what you're doing, and you as the person have to be worthy of the Holy Grail. And so you as a person have to have a body that's receptive to the taking in of that magic juice or cells. And what that means is that if you have a problem, for example, a chronic infection, and then get stem cells, the chances are you're not going to get good results because that infectious process causes some kind of disturbance in the signaling processes so that the stem cells get lost and confused and they don't go to where they're supposed to. They'll probably wind up they'll become dendritic cells or immune cells and attack the infection rather than go fix your brain or whatever. And as an example of this, I had a patient with diabetes, a diabetic retinopathy patient from some place here, I forget, south here. There's a little bay, I forget, about 30, 40 miles south of San Francisco. What is that little bay? Half Moon Bay? Is it Half Moon Bay?
Yeah.
Half Moon Bay, I think she's from there. And her name was Ruth. And Ruth came down for stem cells for her diabetic retinopathy. And she was ready to go, and I'm checking her over. And she had her sandals on, and I looked at her feet, and a little tiny sore on her toe. And I said, well, what's this? She said, oh, that's just a little thing I picked up in the last couple of days. And I looked at it. It just looked like a little sore. And I didn't, dig up my magnifying glass, and I didn't go off and get an x-ray and all that kind of thing, which I should have in retrospect, because she went down, and within 2 weeks that little sore turned into an osteomyelitis, and within a week. And so that just kept getting worse and worse and worse, and she started on antibiotics and whatnot, and that osteomyelitis was cured within 3 weeks, and the doctor said that was the fastest he'd ever seen a diabetic osteomyelitis case turn around. But it took her 9 months after that for her retinopathy to disappear and for her to be able to go back to driving again. So that process of having that osteomyelitis diverted probably 90% of the stem cells to that infection, but she still had 10% or something that still went to that eye, but it took them a long time to grow and to repair it. And so it took her about 9 months for those eyes to repair, and then she was able to go back to driving and whatnot, so she got her eyesight back. So infections are something you don't want to have. I had a patient that came in on Monday from New Zealand, and the reason for that is because we had a case came in about 4 or 5 months ago that was followed by the New Zealand 60 Minutes. New Zealand 60 Minutes came along with a child from New Zealand that had cerebral palsy, and they wanted to follow a child all the way through the course of coming in, getting evaluated, and then being sent down to Mexico for the stem cells. And they did that, and they brought this child in, and I took a look at the kid and looked at the MRI, and I'm saying, wait a second, this is not cerebral palsy. And so the doctors in New Zealand told the parents that the child had cerebral palsy, and I said, this is not cerebral palsy, this is a stroke. And literally 1/3 of the brain was gone. 1/3 of the brain. I mean, this is a massive, massive damage. And so they got this all on video, and me saying, oh, this is not cerebral palsy, this is a horrible case, and this is not going to be very good no matter what. And but you should have if we're going to do anything with this child, we're going to do it by doing an angiogram and put the catheter up into the brain and stick the stem cells in there, because that'll give a better result. And so they did that, and they went home, and they followed this child for 2 months, and the number of seizures the child was having was 100 seizures a day, and then after 2 months it was down to 4 seizures a day, and a lot of other things had improved as well. So this is all on the web, on YouTube, I believe. And if you just put in New Zealand, 60 Minutes New Zealand, and stem cells, or my name, you'll pick up that video. I have it in my briefcase, but it's quite a long presentation. And in that, there's another mother with her child who is similar to this Caleb fellow. This is a 2-year-old, and this other child on the video is more like 6, and he was really messed up. And you see him now, who was almost blind, now can run around and see, and he's functioning. And the mothers are talking one to one, and it's a very emotional video to see 2 mothers dealing with desperately ill children, and one child is already like 80% better, and the other one has improved considerably as well. So it's quite a story. I recommend you look at that. Anyway, in terms of further evaluations besides evaluating for infections, you also want to look for heavy metals, especially in the neurological cases, the Alzheimer's and the Parkinson's and Huntington's and all these things oftentimes have heavy metals. And I recommend what's called a DMPS challenge test for that, or a DMSA if you're from out of state and you can't get to a doctor that does a DMPS challenge. Phil, where's Phil at? Do you do the DMPS challenge test?
No.
Okay, so what do you do for it? You don't challenge?
No, I don't do mercury. I stay away from mercury.
Okay, well, I don't know why that is, but DMPS is generally quite safe. You can give it over a couple hours and 250 milliliters of saline, and you collect your urine for 6 hours and send it off. I've done hundreds and hundreds of those, and I've had no problems with that. And that gives you a handle on what's going on with the person, and you can then see that they do have mercury or lead or whatever, and then you need to oftentimes get rid of it, especially in the ALS patients. So that's something. And then also you have to look at the intestinal tract often. And so I think comprehensive stool analysis and urine organic acids are all very beneficial for looking at the neurological cases at least. Then as part of the pre-treatment, as I was talking before about the bone marrow, I got kind of way over to change topic here, but the osteoporosis can be changed by using a drug called Forteo, F-O-R-T-E-O. Forteo is parathyroid hormone, and it comes in a pen that you give to yourself, 20 micrograms per day, and that stimulates your bone marrow to grow the stem cells. The stem cells grow in about 10 days. They will have anywhere from 4 to 10 times more stem cells. So what I'd like to do if you're coming for bone marrow is to have you on that drug for at least 10 days prior to coming for a bone marrow, because then we increase the number of stem cells in your bone marrow by 10-fold. And if you have osteoporosis, it's good for you anyway, because it makes your bones stronger, and it's an FDA-approved drug for the treatment of osteoporosis. Forteo, F-O-R-T-E-O, F-O-R-T-E-O.
How did you say you give it?
Subcutaneously. You do it yourself. It's like a little tiny needle.
I've done it for 2 years.
There you go. A testimonial.
Just give yourself a little shot.
Yeah. So your stem cells, I bet, are great. You're listening. Another little maxim I come up with is that the more stem cells that you have at the time of the transplant, or for that matter, for any time, the healthier you're going to be, and the better the treatment response you're going to have. I have, everybody seems to have picked up my handout on Stemgevity. Stemgevity is my creation. We spent the last year in my stem cell lab working on this product, and we've analyzed most all the herbs that are out there that have anything to do with regeneration and growth. And we looked at those in terms of stem cells and stem cell proliferation and mobilization. And we put together this combination, we call it Stemgevity. You can order it from this website. Right now the website is down except for the ordering part. The reason why we took it down here yesterday or so was because we made claims like Stemgevity stimulates and mobilizes the stem cells. And it turns out that to do that legally and to keep out of trouble by the FDA, I have to have double-blind controlled studies even on that. So I've got to, and this next week we're going to be doing that study, and so hopefully that will be back up in a couple of weeks as far as the actual website and describing it all. But the way the FDA is coming down on nutritional supplement companies, we decided to get our ducks in a row before we go forward with much marketing. We've had a tremendous number of, already we've been out for about 2 months though, we've had lots of anecdotal stories of different people having tremendous results with that in terms of healing. And it's, actually, you should think of Stemgevity as a growth stimulator. So it stimulates growth. And so you don't give it to cancer patients. Sorry. It's a growth stimulator. It grows if you have a child that's underweight, you give it. If you have a mother who's not lactating and you want to grow and make a lot of milk, you give it to her. This stuff is the best thing to aid lactation that I've seen ever. If you have an acute injury, you fall down and hurt yourself, take this because it will help heal you fast. Stem cells go to areas of the body that are inflamed or injured or lacking oxygen. Okay? So that's what stem cells do and where they go. So the bone marrow procedure itself is, you get all gowned up and sterile and all that kind of thing. Generally, if you're a sensitive person, we want you to come in not having eaten, because if you're going to be sensitive and have a lot of pain, then we may have to give you a little pain pill, or not pain pill, but pain medicine. And if that happens, you may throw up, so we don't want you to have any food in your stomach. Generally, we don't have to do that. Generally, there's no pain. You do it slowly, you don't have pain, and it's a very simple procedure, and people fly right through it. But we're talking about the person who, when you go to the doctor's office and he says, I'm going to give you a shot, you pass out. Or you start to scream at the sight of a needle, or you're very sensitive. Like I see, you're very sensitive, and you're going to be the screamer, and you're going to hurt. So I'm going to have to give this woman some morphine or something to help her get through any kind of procedure, because she's already just nervous and upset looking at that needle over there. I can see that. So she's one that's sensitive to pain, which is there's nothing wrong with that, but it's just something we have to take into account, and we can take care of that. That's not a problem.
Okay.
What happens if the patient has osteoarthritis in their hips?
That has nothing to do with it. We're not going into the hip to take it. We're going into the hip bone, which is outside for the hip joint. So arthritis is in the joint. This is in the iliac crest. Okay?
Does inflammation create an area where there's low oxygen?
Yes. Yeah, just think about it. It causes irritation and swelling. And swelling causes compression of the blood vessels. And no blood vessels working, no oxygen. Okay. And this is just showing the patient recovering, laying there, resting, relaxing.
Could you go back to
I'm sorry?
go back to the 3 and 4 steps? Yeah, No, the next one.
So this is just an IV bag with bone marrow in it. This is a blood filter.
What is it filtering out?
Oh, mostly little fibrin clots. Like this person I was talking about earlier that was having suffered from multiple sclerosis and was paralyzed and whatnot, has osteoporosis and everything. His blood clotted like nobody had ever seen. Normally I use like 6 to 10 milliliters of ACD anticoagulant, and his I put 20 cc's, and as soon as I brought in 10 cc's of his blood, it started to clot. I mean, it was clotting when it was 1 to 1, 1 part blood, 1 part anticoagulant. Usually it's 1 to 10. Okay, so I got problems with some people, and so you want to have a filter. But as long as you have a filter in there, we have never had any problems.
That's diluted with saline, right?
I'm sorry?
That's diluted with saline, right?
A little bit, yeah, not much.
Don't feel anything important.
Good line. As I said before, you know, the body has got to be worthy of the stem cells. And so aging is a factor to consider. The older you are, again, I don't think that it's necessary that aging itself is the factor, but aging is usually associated with decreased growth factors and osteoporosis and all of these different things that contribute to, and of course, the oxidizing properties, the free radicals that are in your body from inefficient metabolism. As we get older, our metabolism becomes more and more inefficient, and we have more and more free radicals. Now, those free radicals then start to cause mutations in the DNA of the stem cells. And so now we have stem cell mutations that we're dealing with an aging person. Or nutrition, different toxins. Vern was talking about raw foods, and raw foods having toxins, and how eating a raw food diet may not necessarily be the healthiest thing in the world. And again, the same thing is true for stem cells. The raw food diet may not be the best thing to do for most of us, because if you have raw foods and nuts and seeds especially, you irritate the intestinal tract, and that can allow bacterial cell wall metabolites to get into the system. Those are called lipopolysaccharides or endotoxins, and they have a detrimental effect on the body and can contribute to osteoarthritis and brain disease and all kinds of things. Yes, sir?
Just about, probably everybody in this room knows of people who have gotten better for all kinds of things from cutting back on how much they eat and from eating sugar and starch. Have you seen any correlation between how well somebody responds to these treatments when cutting back on food intake?
I have one piece of toast today.
Yeah.
Like I know somebody who completely cured osteoarthritis by cutting back for about 8 months.
What kind of arthritis?
Osteo, just cured.
Well, that could be, you know, again, we're talking about the health of the intestinal tract usually. So the health of the intestinal tract and the health of the liver for osteoarthritis is very important. And of course, you're getting rid of sugar, then you got rid of perhaps the yeast and bacteria. Lamar Gibbons wrote a book called, I think, the irritable bowel syndrome or something like that. And when you open up the book, there was nothing about irritable bowel at all. It was all about osteoarthritis. And I asked Lamar, I said, Lamar, why did you write a book about osteoarthritis and call it the irritable bowel syndrome? He said, well, because the Arthritis Association doesn't believe there's anything to do, the diet has anything to do with arthritis. So if I said anything about arthritis and diet, they would have come after me. They didn't want to do it, so I mislabeled the book. And that's how paranoid doctors are about the bureaucracies that we're having to deal with, and that's still true today. And so I'm paranoid too. Yes, sir.
Are there any other nutritional measures that help? Protein.
Well, I was going to say, yeah, generally, I always tell people protein, eat more protein because, again, you're building tissues. And then in terms of dietary factors, I always tell people that you want to think of yourself as being a pregnant lady in the first trimester. And anything that she can do, you can do generally. If she can't do it, you shouldn't do it either. So you're not supposed to be drinking alcohol, for example, and smoking cigarettes. And you're not supposed to be going down to the gas station and snuffing the gas fumes and taking your fluid.
Okay. Can you replace some of the growth factors by taking first milk colostrum? Have you seen some of the studies that came out?
I think that's a valid approach. I've never really had much, it's one more thing to study.
Yeah.
And I've got my hands full of other things to study, I just haven't gotten around to that. I have treated with human breast milk. And so if in some cases, I'll try to get the person to do it. Very rare because it's hard to get them to do it and all that, but it seems to be helpful to some degree.
Does donating blood help stimulate your bone marrow?
Yes, and that's another good point. Thank you very much. And so also as part of my therapy, oftentimes if you're a healthy person and whatnot, I'll take a couple hundred cc's of blood to stimulate your erythropoietin. The erythropoietin stimulates your stem cells to grow and to multiply, so that's a beneficial thing. You can use erythropoietin for treatment of acute stroke and acute heart attacks as well, just like you can Neupogen, which is that agent I was starting to talk before. I'm so disorganized here, sorry. But when you get cancer and you're getting, and they're taking stem cells from your peripheral vein, they give you this drug called Neupogen or Ilvestrem, which is granulocyte colony stimulating factor, which stimulates your bone marrow to release the stem cells into the circulation. And that's what my Stemgevity is supposed to be doing orally in a much cheaper, safer fashion than the shots. The shots are about $3,000 for 5 days. That's compared to my $70 for a month kind of thing. Yes, sir.
Have you seen any improvement with hearing loss?
Unfortunately, I haven't. Sorry. Just hate to tell you that, but it's true.
What about epilepsy?
Epilepsy, like I say, this Cal, French, I think, Cal Turner, the New Zealand case, 100 seizures a day down to 4, and I would say that's pretty consistent. I've seen in many, many cases we've had now in the last 3 or 4 years with seizures now, especially with the umbilical cord stem cells. And I think that using umbilical cord stem cells, especially the CD34s, CD34s, the hematopoietic stem cells, go to the white matter. So when you look at an MRI, and if you see on an older person, like MS, they have white matter damage, they will respond generally to the hematopoietic stem cells. And so I look at the MRI for how much white matter damage there is, and if there's lots, then I say, well, for sure we have to have CD34s here to treat. Okay? And so epilepsy oftentimes will have that, and if they have white matter disease at all, then the CD34 stem cells will be very effective. Okay? And that's just another little story. I had one case, I think it's on the web. In fact, it's I think it's on Burton Goldberg's video. If you go to burtongoldberg.com, he has a video out on my work as well. And in one of those cases, it was a 3-year-old who was blind from birth. And the father sent out the MRI to me, and I looked at it, and it was the most massive damage I've seen. It was just like 80% of the brain was damaged. It was mostly all white matter. And so I said, well, white matter is the thing that CD34 would work with. And so I told the father, I think that this child is going to respond quite well, even though that he couldn't talk, he couldn't see, he didn't hear much, and he couldn't walk, he couldn't move. He was otherwise in good shape. And they brought the child down, and he went to Mexico, got stem cells, and then about every week I got calls from this father saying, I think you're a quack. I think this is a sham. I think you're a ripoff. You're taking my money, and because this child hasn't gotten any better. And every week he'd say the same thing, and just bitching at me constantly. I would say, hey, I tell my staff, tell him to go see this other doctor and get some real stem cells someplace. Leave me alone. And 3 months to the day after, and I told him it was going to take 3 months before he would see any improvement. And basically 3 months to the day, he's sitting in the living room, and the child is sitting there also in the living room, and his brother comes in, throws the ball across the room, and the kid turns his eyes and looks at the ball and watches the ball. So we got his eyesight back at 3 months. Not back, he never had it. So this person who happened to be an attorney for the Department of Consumer Affairs for the state of Florida now became a great advocate for stem cells. So we changed him around. I think this down here again, loss of growth factors decreases the vitality of stem cells and causes aging, I think is extremely important. And if we could just replace everybody, keep everybody's growth factors up at the level of a 20 or 25-year-old, I think it would do tremendous good for all of us in terms of staying healthy.
Can you cover the rest of the points on that page? We distracted you a lot, but you didn't get to the last three.
This stuff? Well, we already talked about infections.
But I mean, you can use it to help with infections?
No, I say these are things
okay, right.
that decrease the effectiveness
Right.
of the effectiveness of bone marrow or umbilical cord or fetal or embryonic stem cells. These are all things that you should be thinking about what to do. You know, genetic damage, you know, if you have, that's like if you have genes that are already mutated at birth, that kind of thing, that's one thing. And then you have genetic damage from mutations from the living, smoking cigarettes and all that kind of thing. So all those things contribute to genetic damage. And the more genetic damage you have, you're going to have, again, I think, lack or less growth factors than otherwise. And again, I think I've said all this already. Optimum levels of growth factors must be present. So we have growth factors for brain. So if you have Parkinson's or Alzheimer's or MS or any of those things, we combine the stem cells with growth factors. And we're getting new growth factors all the time. We're expanding our horizons in terms of the people we're working with, and with that, people that are world travelers, basically traveling the world, talking to other people around the world doing stem cell therapy. We're all able to come back together again and help people better in our either in Michigan or in Tijuana.
Is it possible to synthesize growth factors? I mean, you can go on a market and...
Oh yeah, and they're made synthetically even now, like hybridomas and all that kind of thing. Especially in Japan, they're bringing it in and selling it. Yes, sir.
And you mentioned several times in your presentation glyconutrients. Can you talk about that?
I mentioned glyconutrients.
Like some of your slides. In your slides, you said something about glyconutrients.
Well, I'm talking about glyconutrients. That's nanotech you're talking about. So ambrotose is not a bad stem cell mobilizer, and I tested that. It's not as good as longevity, but nanotech has been wanting to, the guy that's one of the top men there and I have been talking about adding my product into their line. And he wanted to do it months ago, and I told him no, I wasn't going to do it until I had a lot of cases. And,
Because the glyconutrients are like sugars, right? And there's what, 7 or 8 different types of those sugars, and some of those sugars, what do they do for the body?
oh, that's another hour lecture. I think in general, it's the mannose type. The mannose itself has an IGF-1 or IGF-2. It stimulates IGF-2 receptors, and so nanotech or those kind of things that actively stimulate growth factors because of that IGF-1, IGF-2 receptor stimulate. It has a 60% activity on those receptors. So I think that's one of the factors in how it works. Exactly how and why it stimulates stem cells to grow, maybe just that, maybe other factors, I don't know. I just know that, you know, the people from Manitech were telling me how great it was, so I tested it. And of course, it's patented, so I can't use it in my product. And so, but we could combine it. So one of these days, the combination of stem cell stimulators, hormones, growth factors, elimination of toxins, infections, and other problems before, during, and after the procedure enhances the results. So when you finish the treatment, you want to make sure you don't get an infection. I've had people go home and on their airplane home, sit beside somebody with an infection and come down with an infection, and there goes the whole therapy. And they just spent, you know, $4,000 or $8,000 for umbilical cord stem cells, and that's the way it goes, because they sat beside somebody who came down with this cold or pneumonia or something. Kills the whole process. Each case is different. Some people may take a lot more time to prepare for the procedure than others. And again, repetition gives additive results. Now I've got some success stories of anti-aging, cardiac arrhythmias. I had one lady who had, I remember she, 84 I think she was having bigeminy, trigeminy, PBCs, PACs, you name it, she had it. She had bradycardia. She had just, it was a mess. She was on oxygen, could hardly move. And I treated her with stem cells, and within 1 month, her heart flipped back into normal sinus rhythm, with nothing else but stem cells. And she stayed in normal sinus rhythm for 3 years, went back into the same kind of crappy rhythm, gave her another set of stem cells, and again for another couple of years. She's now 91 years of age, and doing pretty well, still in normal sinus rhythm. Heart attack again. This is a fellow who had, this was about 10 days after a heart attack. He reported that he had a lot more energy and endurance. His arthritis improved, and he was able to get back to work earlier than normal. And the main thing about treatment of heart attack victims is that it salvages heart tissue, heart muscle, so you don't go into congestive heart failure later. Because what happens is you have a heart attack, you say, oh, I'm over that. That's good, I lived through that, so now you tell yourself that that's all there is to it. You're fixed, you're fine, it's all healed, but it's not. You've lost maybe 30% of your heart, and it no longer functions. And so a few months later, you start wondering why your feet are swelling up, and why you're having shortness of breath, and why you're fatigued all the time. It's because your heart is not able to function, and you started to get congestive heart failure, and then you go on to have more and more problems and die because of that congestive heart failure. So you don't want to have that happen, so you want to fix that heart muscle as fast as you can, and that's where stem cells come in. This is this one child in this video I was talking about from New Zealand. This is Tyler. This is a quote from the mother. Today he walks, he talks, he can spell words. He couldn't walk before, he couldn't talk before, he couldn't spell anything. His vision, he couldn't see. Now is, I think it's 2020, and the teachers are saying it's like he's remarkable, and he's beating his buddies at video games.
But that was really a stroke, not cerebral palsy, right?
That's cerebral palsy, yeah.
Wait, I thought this was the New Zealand kid who actually had a stroke.
This is the one that's on the video with so that those two mothers got together and at my place, and so the mother, this mother, was able to help the other mother get through it, because if she needed support, and there's nothing like another mother who's gone through it, and so she volunteers, and she's got a website, and she volunteers to do this for people, and you can call her up and talk to her about it.
So you can do this with adults who have cerebral palsy too, by the way.
I would think so, yeah. I haven't had too many adults. I remember one patient, hyperbaric oxygen works also for cerebral palsy. And one of my cases was a 50-year-old who never spoke. She was, as a cerebral palsy, she never could speak. And after a course of 60 treatments of hyperbaric, she was able to speak for the first time. And she speaks now like you and I. So even at the age of 50, you can see some significant improvements in cerebral palsy. And I think pretty much any of the other most of the other brain injuries, yeah.
Will your stem cells work on rheumatoid arthritis? You didn't mention that.
Well, rheumatoid arthritis is an autoimmune disease, and so there's some evidence that the bone marrow will help, but you usually want to do something about the reactive T lymphocytes. And if you can get rid of those and get just more mesenchymal stem cells in, then you'll be able to get some benefit, because mesenchymal stem cells will help suppress the immune system. And so they are very helpful for inflammation and autoimmune conditions. I have other therapies for autoimmune conditions as well. Let's see, what is it? Oh, this is just a kidney case, showing his kidneys improved. Patient with prostate, PSA high, low. I had one with a positive cancer, prostate cancer that went into remission with stem cells. So the stem cells are generally, in terms of cancer, thyroid, breast, and prostate, they have effects and can help. This ALS, we're talking about the patient with ALS. He's still going. It's been 3 years now, I think. He's still functioning. And I was saying that using the cerebrospinal fluid for the last few years, we've been, we keep trying this and trying to figure out what works best for each kind of case. And the Chinese have been helpful because they've been doing so many cases. They've got, I don't know, about 100 or 130 hospitals doing umbilical cord stem cells. They have 2 central facilities that are like very large stem cell manufacturing plants, and they take these stem cells and without freezing them, they have them in bags and they ship them all over the country in these bags and then give them to the patients. And then each one of these hospitals do it differently as well. So each doctor is kind of on their own. They get the stem cells and they say, well, let's try this and do this and do that. And then they report. And so you can go to ChinaStemCells.com and you can read all the reports and you can see what they're doing with different kinds of cases. And from that you can get some ideas about how to treat here. Again, for the older patient, removal of harmful substances from the diet and body, correct mid-place optimum levels of all the growth factors. Continued supplementation of different growth factors are needed for at least 40 days after the stem cell treatment. I talked about stemjevity.com and that product, and if that's all of that, I can talk and answer more questions.
Can you say what's in this?
Can I say there's a lot of brown seaweeds, for one thing. There's a touch of lithium. Lithium actually stimulates stem cells and inhibits GSK3 beta, so that's anti-inflammatory. It's a homeopathic dose, the kind of thing you get from the health food store. Combine that with everything synergistic, so it's a combination of about 8 different things at least that all combine together to work. There's a product, Stem Enhance, that's on the market that uses one product, one type of extract, and so it doesn't work in every case. I think everybody's different, and so by using 6 or 8 different kinds of stimulators, I figure we get a broader, more useful thing for more people. Yes, sir.
If you're borrowing stem cells from someone else, do you have to match the blood type?
No.
Okay.
Sometimes you do, but most of the time not. For example, if I took mesenchymal stem cells from this lady, I could pretty well give them to any one of you without any problems.
Okay.
Does your blood type change? So I thought once you have stem cells, then your blood type changes to whatever stem cells you receive from the donor. Am I correct on that?
She's asking, does your blood type change if you have it from a different donor? And that's true if you have chemotherapy and total body radiation and break out your own system. And then you get a transplant. Then you have somebody else's total bone marrow in your own. And so now you have a different blood type than you ever had before. So you may have had A positive and you can go to A negative if you really did it right. That's not what we do. This type of therapy is not one of, in general, replacement of tissue of your cells, but a combination. That your cells combine with the cells, the umbilical cord or other stem cells. The stem cells will join with your sick cells, and they form one cell, and that makes one healthy cell. And that then is able to help revitalize the tissue. And then there's growth factors that help repair the tissue too, so you can have damaged tissue, and the growth factors from the mesenchyms or whatever, they are able to have a salvaging effect and lift up the health of the damaged tissues. So you're not replacing it as such. Yeah.
Can you explain, please, what Stem Enhance is in comparison to what you do?
Well, Stem Enhance is an extract of blue-green algae from Lake Klamath.
Yeah.
And so it's one particular extract of that one algae. Mine is extracts of like 6 different algae, and so they're different ingredients. Mine has more different ingredients, is basically the point.
But yours is, I thought, taking the cells out and injecting them.
No, no, you're completely confused.
I guess I didn't even get it.
Yeah, Stemgevity is an oral product. It's a pill.
Oh.
You can buy that, and you can take that tomorrow. And it's just like Stem Enhance. It's an oral product. It's not multi-level. You can just buy it. You can, on it, you can go and become something like, I forget what a referral agent or something, and you go to become a referring agent. You can then buy yours, and if you tell your neighbor about it, then you get $5 or $10 off, or from credit from that other person, something like that. I don't know what it is. But they're competitors. Stem Enhance is our competition. They're multi-level. They're an extract of the blue-green algae. Mine is from mostly brown seaweeds. And so, for example, I've had a product called Stem Mobilizer, Stem Cell Mobilizer for years, and that's all brown seaweed. And those are fucoidins. And fucoidins have antiviral activity, antibacterial activity, stem cell mobilizing activity, anticoagulant activity. So they have a lot of properties that are beneficial. And so I use both of those at times when I need, for example, a product that, my product has 1 milligram of copper. Stemgevity has 1 milligram of copper because copper is essential for all growth factors. And it's amazing how many people have a deficiency of copper. So I'm trying, like this product, I say Stemgevity is a product for growth. It's made for growth, not for anything else. And so you have to remember that's what it is. It's got copper in it, it's got lithium in it, so it's anti-inflammatory. It stimulates growth. It has all these growth promoters and stem cell mobilizers and stimulators. One of the things it does, it seems to, is that you can take my product, a little bit of the product, and put it in blood in a test tube and throw it down here on the bench and come back in 4 days and pick it up and measure the stem cells, and you've got 2 or 3 times more stem cells there in the test tube after 4 days than you had when you put it down there. And that's totally amazing that actually this product keeps those stem cells alive and growing.
We have some questions on the other side.
Yes, ma'am.
What is the optimal way of dosing the Stemgevity to get the best results?
Well, I don't know if there is an optimum way. I think you can start with 1 tablet or 1 capsule and see how you feel.
With food, away from food,
I think
time of day?
Generally, I recommend at night. In general, I think stem cells are more active at night. I think they're going homing better at night. Their body is under lower levels of oxygen at night, and so all of that contributes to more stem cell mobilization and repair processes. So you're just trying to augment your own body's natural healing abilities that way. But you can take it during the day too. So, for example, if you have attention deficit disorder, you can give it 1 capsule 3 times a day, and that will help calm the person down throughout the day. That kind of thing. Yeah.
Do you have double-blind, placebo-controlled studies and validation on your product?
No, that's what I was just saying, that's why the website is down, because we're setting that up for the last couple of weeks, setting that all up, so we do that, we're doing that this next week, we're starting that.
Publishing papers in a peer-reviewed journal?
How can I publish when I haven't had to double my studies done?
Sounds like you're in the right.
Yeah, that's what I'm doing, yeah. Way
Seems
ahead.
sounds pretty good.
Two questions. Do you have any experience with people who've had kidney failure trying this?
Yes,
Does it work well?
it helps.
Okay. And my other question, I heard a doctor who works with stem hands once say that you have to get rid of all the inflammation in your body for the stem cells to work.
Right,
Would you agree with that, and does
Yes.
that also apply to your product?
yes.
Okay.
Yes, ma'am.
You said you couldn't take it if you had cancer. What if you had breast cancer 6 years ago and you had the lumpectomy and you had all the cure? Could you take the tablets
Sure, if
today?
you're 5 years out, after cancer, there's usually no problem.
Thank you.
Yes, sir.
What's the approximate cost of the therapy, including preparation and the actual stem cells?
Well, it varies.
Roughly?
Well, the basic bone marrow transplant is like $2,500. If you go to Mexico, it's $4,000 to $10,000. So we're, I think, quite reasonably priced. The preparation, though, is going to be different because everybody's different. So if you, like I have one of my patients with MS, I did the test for heavy metals, I did the test for this and for that, I started treating this, I treated that, and we treated her for 6 months, and she got up and walked normally and functioned normally, and she never did need stem cells. So we never got to do stem cells. She got to stay every week. When are we going to do stem cells? I said, well, when we get you cleaned up and fixed up, then we'll do it. But when she got cleaned up and fixed up, she didn't need any stem cells. And she's been now in remission for 2 years without stem cells. So, everybody's different, and you have to, like I say, clean up the person, and do what you can to make them as healthy as possible. And who knows, the body's own stem cells will fix. You have too many of them. Again, on the website, YouTube, you can see patients' testimonials and talking about macular degeneration. Who hasn't asked a question here? You guys are, that's it. Go ahead.
On one of your slides, it said dementia.
Yeah.
Kaiser told my family that my wife has dementia due to 2 scans several months apart showing loss of tissue, mass lesser. So some years go by and they're saying you can do nothing, they don't know why it happens, they have nothing to do about it, and so she's now 2 master's degrees, 29 years, retired elementary teacher, can't put 3 words together, goes from bed to wheelchair back up, we're waiting for her to die when her brain dissolves. So this can fix that, and Kaiser's down scratching her head?
No.
No,
Too
okay,
late. Probably too late.
that's my thought.
Too late. 10 years ago, 5 years ago, when she's mild to moderate, you can turn her around. But when you get to that severe advanced stage, it's pretty much hopeless. Now, if you have plenty of money and want to spend it on it, hey, we'll try. Because you never know. I swear, I have been fooled many times. I have told people I don't think there's a hope in hell here that you're going to do better on this program. And they say, well, I don't care, it's my money, I want to do it. We do it, and fine, but sometimes they get better. I don't know. I can't say, I don't want to say no, but, it's doubtful if she's that bad. It's doubtful, yeah.
You've given us a lot of best cases. What about worst cases? What percentage of people just don't respond to the stem cells, and what percentage something goes wrong?
Well, don't respond. It depends on which kind of cases you're asking. So I would say best cases, 80% will respond, like cerebral palsy is probably 80%. Again, it depends upon how you treat, how many cells you give. So if I had unlimited funds to treat and do it like I wanted to, probably the percentages of success are going to go up. So 1 vial is good for cerebral palsy, 4 is much better, and 8 is even better. And the same thing is true for most other cases. So, for example, the Alzheimer's case, 1 vial is probably not going to do anything. But if you gave her 6 vials every 2 weeks for the next 2 months, and you did it, into the cerebrospinal fluid, probably have some pretty significant success. In her case, when she's that advanced, it's hard to know what that would do because it's so far advanced. So, you know, it varies. Now, you almost have to ask me what kind of disease we're talking about so we get more specific because we don't have, you know, we've done quite a few cases, but not thousands either. So all we can do is kind of give you a rough guesstimate as to what kind of percentage we're going to get from any particular case.
What can go wrong?
What can go wrong? What can go wrong? Well, I have, when you have a bad calf man and he screws up the catheters, you can put the catheter in the wrong place, or you can have a hemorrhage at the femoral artery site. But I fired those people the first time that happens. So we haven't had any problem like that for some time. So, let's see. 3 years ago or so, 4 years ago, 5 years ago maybe, as an experiment, I allowed I told the lab to not wash the cells as much as they were, so that some of the stem cell growth factors would come through and be part of the preparation. When we did that, we got some skin rashes. And so when we had that happen, we had 3 or 4 cases like that, and we stopped that. So we haven't had any problems since then from that.
But like, for example, you can't be sure that someone has no cancer.
Well, that's
you might
true.
be stimulating
That's
that.
true. I had one 93-year-old who had a number of stem cells, and she went on and got developed leukemia at 94, I think. But at 94, she probably might have developed it no matter what. So, but that's the only case I've had that came down with cancer afterwards.
You do this treatment in the United States, or what's Mexico got to do with it?
I do bone marrow transplants in the United States. In Mexico, we do umbilical cord stem cells. Umbilical cord stem cells, a lot of people get confused. When the baby is born, there's a cord that goes from the baby to the mother, and it's connected to the mother through the placenta. The placenta is hooked onto the uterus. The uterus feeds all of the nutrition into the placenta. The placenta takes it and puts all that blood into the umbilical cord that goes into the baby. When the baby is born, we cut the cord, take the cord and the placenta, and usually toss it in the trash. So instead of putting it in the trash, we grab it from the trash and take it to the lab where we extract the stem cells that are otherwise would have been in the baby. See, because the baby's got the same stem cells as in the cord. So now we have really the baby's stem cells, but the baby's healthy and they're over there with mother. And so we've got healthy baby stem cells. And these are full of growth factors and are very vital and very able to go into tissue and dig into tissue and grow into tissue. Whereas your stem cells are really poopy. They just don't want to do much of anything. And so that's a big difference. And we have a fresh, vital, for example, to show you the difference between you and the baby, my grandson, when he was born, he weighed 8 pounds. In 1 month, he weighed 16 pounds. He doubled his weight. He doubled his weight. That's growth. You know what I mean? That's the most growth you'll ever have in your life in that first month. Well, think those stem cells that he had when he was born, those are really into growing. Where your cells, when are you going to double in size? They come up to your belly. So those umbilical cord stem cells are very vital and very functional. Yes.
Has the newly enacted legislation going to affect your research at all?
I doubt it. I doubt it. I think, like I say, rising tide brings up all boats, and that's good. And the more people know about stem cells and how positive it is, the less chance the government's going to come down and stomp on me. So I expect all of you to show up in Sacramento and they haul me away.
You mentioned Germany and China. Which other countries are working on the technologies or getting advanced in the technology?
Israel and Finland.
I didn't understand your question.
Which other countries are they working on
Well,
stem cell therapy?
yeah, well, we are here, of course. University of Pittsburgh is leading the way here. They are working with Israel and then with Thailand, and they have companies there that are interacting and whatnot. Iran is a leader over in that area. Russia has got quite a bit of activity going, but they're more into fetal. That's what we hear about. I don't know about anything else. But basically, the United States is number one. Korea and China are the most advanced in terms of probably practical. China's done more. They've got, like I say, over 100 hospitals doing that, so they've treated probably 7,000 to 8,000 patients with umbilical cord stem cells in the last 4 years. So they're very active. The place in Tijuana, I'm trying to set up right now for competing with China. I have an FDA GMP facility in San Diego that has agreed to take your stem cells and grow them and deliver them to our hospital in Tijuana so that you get FDA GMP grown stem cells for you. They can be delivered in Mexico legally that way. The American company is legal because they're supplying research and development products to Mexico. And so that looks real promising. And we should hope to have that up and running in the next month or so. From that, we can take fat. Fat stem cells have great potential, especially for osteoarthritis and for facial work and cosmetic work and a variety of different things. They're as good or better than any other stem cell, and God knows most of us have lots of fat to use for stem cells. And so that's a new thing. There's a company called Cytori in San Diego that's got a machine that's going to become available within the next 3 or 4 years, hopefully, and that I, as a doctor, can purchase and use in my office and take your fat and run it through this machine, and out the other end comes your stem cells in 2 hours. And so that's going to revolutionize the practice of medicine in the United States, and hopefully sooner rather than later. So lots of things happening.
Thank you. We have to adjourn the meeting now, but the people will
This guy never asked one question. Not one.
Okay.
One more.
Your location and phone number.
My location, I'm in Mission Viejo, California. My 800 number is 800-300-1063. I've got plenty of cards. I wish that you'd all take my cards, pass them out to all the sick people that you can find. I'd appreciate it very much. It helps my research and helps people. Thank you very much.
I forgot to mention, there's a Living Expo exposition next weekend.